Unification of individual consciousness with the higher consciousness. Union of a Jivatma with Paramatma. That's a bigger word, we don't understand it. We'll say that unification within me, I feel unified with my body, mind, spirit. This is acceptable. And with the higher, whatever cosmic energy, spiritual energy, whatever you call, based on your beliefs. So that energy which has made us, and within us, these three combinations. In a modern medicine, we say recent medical advancements are like family medicine, integrated medicine, are recognizing the importance of mind. So India being scientists of souls through yoga and Ayurveda, we thought of combining this idea of yoga, so that's why we call it as medical yoga. So in our team we have Ayurveda doctors who have done their MD in yoga and rehabilitation, two of them already, Dr. Nagaraj and Dr. Prakash, and homeopathy doctors, Dr. Rashmi, Dr. Jayanti madam, again, and Shweta, she is a consultant, counselor. So team, in the sense, we want to reduce the cost of medications, because medical system has become another business venture, is it not? It's a big business venture. The moment you go inside any hospital, name it, any hospital you go, you will see a posh, seating arrangements, everything absolutely stunning, good looking, and cost is also same. We want to reduce the cost effectiveness of these medical facilities as minimum as possible. I'll just share one or two sentences and I will stop this kind of talk and we'll do some practices. Like we want to do some of integrated yogic hypno-relaxation techniques or integrated hypnotherapy sessions based on working on the subconscious mind as low as one currency of your country. So if you give me 1 rupee, I will give you something. So this is the concept we are working on presently. So because we want to use a medium of internet and say for example somebody is very anxious, integrated relaxation technique for anxiety. I'll give you 1 rupee online, take it and do it. Do it. Why we have to do it every day? It's because I want to work on subconscious mind. So I want you to do some of the therapies every day. So I'll cut short my talk now. I'll just ask how many of us have some diseases. If it is okay for you to raise your hands without taking name, we'll do it. Okay? How many of you have diabetes? Because India is the greatest achiever in diabetes, number 1, world capital of diabetes. How many of us have back pain? Headache, sleeplessness, for women disturbed periods, still have. I'll use some of the mudras. Why I'm asking, I'll use some of the mudras where it is, rather than me talking something extempo, so we'll talk something which is related to us. How many of us have sleep disturbances? Any other major issues? Heart related ailments, hypertension. So these are common issues. Why I am raising this? Statistics says 40 million deaths per year due to non-communicable diseases. Note down this: 40 million deaths per year due to non-communicable diseases, which constitutes about 70% of all the deaths. 70% of all the deaths because of non-communicable diseases which can be prevented. That's how the importance of yoga and Ayurveda goes more. So shall we do some of the workup? So whatever I spoke, you will 100% I know that you are forgetting. You are going to forget within half an hour of instead of from this auditorium. Shall we do some practice? Yes. Okay. What you are going to learn right now will be something very, very new, very unique, very absolutely scientific. Because speaking to scientists is not a joke. I can teach some Nadi Shodhana Pranayama, left nostril breathing, Om and something like that, and say Namaste and go. But convincing scientists, not easy. So whenever you are angry, how will be your breathing? Let us start the practice now, but just a bit introduction to the practice. Whenever you are angry, what will be your breathing? Fast, irregular, erratic. Agree? When we are very calm, what will be your breathing? So So you agree that there is a definite link between emotions and breathing. Do you? So my technique is based on this. Shall we do it? So I combine some of the hand gestures, mudra, and breathing technique. So uniquely, for each disease I change mudra. This is very unique, absolutely unique. Why I use mudra? I want the mind to focus on something neutral. Because our mind is going now, you're all sitting here, somebody will be thinking, my daughter is there in the school and at 4 o'clock she will be coming and all those. You know? Boys side they'll be thinking when the Saturday will come and so many things. So to dissociate my mind from routine thoughts, I want to use some technique. I call it as a thought dissociation technique. So simply I combine medical knowledge, yoga knowledge, psychology. Shall we do it? Mudra I use because scientifically number of receptors are maximum in your hand compared to any part of your body. If you see a word called as motor homunculus, so thumb has the biggest area in the brain, motor area of your brain. Thumb contains the biggest area. Second highest number of receptors from your lips and tongue. That's why there is a lot of importance for kiss. Understand? So shall we do it? Hold your thumbs like this. All of you. Thumbs up.
We do it. Yeah. You want to do it?
Other 4 fingers cover your thumb. If somebody is very angry, you can hold it as tight as possible. If somebody is like this XYZ person, you can imagine that person and crush him. Release your lower 4 fingers. Cover your knuckle area. Thumb touching the middle finger. If it is possible, otherwise you can just hold like this. Twist your hands, hold it onto the chest. It looks like a seashell or a conch, shankha. Does it look like a shankha? So shankha, mudra. Name of the mudra is shankha mudra. We'll do it one more time. Thumbs up. 4 fingers you cover like this. Release your lower 4 fingers. Cover your knuckle area. Thumb touching the middle finger. Twist your hands. Hold it onto the chest.
Beautiful.
So this is one way to dissociate our routine thoughts. Second way is to use breathing in a systematic manner. 4 seconds I'll use it for breathing in. 4 seconds holding the breath. 4 seconds exhalation. Somebody recently taught me 1001. When you say this is 1 second. 1001 is 1 second. So at the number of thoughts which are otherwise bothering. So it's impossible to catch your mind just like that directly. So I'll use indirect method to dissociate the thoughts. Okay? Shall we do it? So podium is coming in between us, but still please be in tune. Hold it onto the chest. We'll do for about 10 counts. 1 count is 4 seconds breathing in, 4 seconds holding the breath, 4 seconds exhalation. I'll give you one challenge in this. Whenever you are doing the technique, if you are doing the technique right, you will not have any other thoughts in your brain, mind. If you are not doing the technique right, you will have all sorts of thoughts. So let us do this as a flow. Breathing in, holding, breathing out. Breathing in, holding, breathing out. So later I'll tell, depending on some disease, I'll change the mudra and I'll ask you to practice. Shall we? Want to hear, shall we?
Yes.
Yes. Close your eyes. Keep your both hands in front of your chest. Be aware of the thumb and the gentle blood circulation around the thumb. Focus your attention and awareness around this point, focusing on your blood circulation. It's brilliant to hear a combination of most scientific medical contents and yoga, medical yoga. After this, we will breathe in for 4 seconds, hold the breath for 4 seconds, breathe out for 4 seconds. Right? Breathe in, hold your breath, breathe out. Breathe in, hold your breath, breathe out. Breathe in, hold your breath, breathe out. Do it slowly. Breathe in, hold your breath, breathe out. breathe in, hold your breath, breathe out, breathe in, hold your breath, breathe out, breathe in, hold your breath, breathe out. 3 more times. Breathe in, hold your breath, breathe out, breathe in, hold your breath, breathe out. Last time. Breathe in, hold your breath, breathe out. Very slowly and gently release the hand gesture. As slow as possible, slowly and gently open your eyes. Possibly majority of you, what you could have experienced is some little warmth around your thumb.
Yes, yes.
So that is one simplest possible example that your prana shakti of your body or subtle bioelectrical energy of your body can be modulated. Or simple blood circulation can be changed, made it aware in the form of heat. So that will act as a psychological dissociation technique. So I usually give it in the form of prescription. When I said medical yoga, I'll give it in the form of prescription. 4-4-4 is a breathing technique name plus Shankha Mudra. So 4-4-4 Shankha Mudra, 20 times morning, 20 times evening for first 1 month. If somebody is interested to enroll for a small research with Srinivas Murthy sir and our director sir, you can enroll later. So what is the concept? We will check your spirometry, peak flow rate. What is your lung volume? How much amount of volume of air you can exhale out? We will check it basically after 3 months we can do another, or after 1 month we can do another, 3 months another, 6 months another. Definitely with this particular breathing practice, I am sure that your lung volume is going to increase. See how specifically we are talking. Peak flow rate. So 4-4-4 breathing technique plus Shankha Mudra, 20 times morning, 20 times evening for first 1 month. Is a prescription. 1 time means 4 seconds breathing in, 4 seconds holding the breath, 4 seconds exhalation is 1 time. So second month onwards, 6 seconds breathing in, 4 seconds holding the breath, 6 seconds exhalation. 20 morning, 20 evening. For second month. Third month onwards, 6 seconds breathing in, 6 seconds holding the breath, 6 seconds exhalation. 20 morning, 20 evening for 3 to 6 months. Notice most of psychosomatic issues will be reduced. National Institute of Health says that 70% of primary physicians' visits are related to stress. 70%. It's a big statistical information. So, will you be able to practice? Okay. One of, I think five diseases name you can take. I'll change the mudra. That's all. Breathing technique is same. 4-4-4. 20 morning, 20 evening. 6-4-6. 20 morning, 20 evening. 6-6-6. That's same. But only mudra I will change. Back pain? How many of you? Okay. Holding the thumbs up, stretching it little extended, is called as Meru Danda Mudra. Meru Danda is the representative of your spine. There is a statement that each cell of your body has a holographic image of your entire body. So this looks like S. Thumbs looks like S when you see it from the side. So this is a depiction of my spine. S is looking like my spine. So Meru Danda is nothing but a meaning of spine in Sanskrit. Meru Danda Mudra. So definitely, I will not say believe it. I will say practice and see it if it is going to work. What I propose is a pain pathway. Just like Amrutanjan or whatever pain balms you apply pain balms to your knee. Superficial nerves of your skin will be irritated and they send signal to the brain that there is something irritation. So brain focuses more on the superficial part, forgets the deeper pain. That's how you will relieve knee pain and back. Similarly, exactly same. I want this thumb to be extended, and the extension part will feel the signal of stretch to the brain. Brain will focus on this and forgets the back. Back muscles will be relieved. Does it look a little scientific or no? Anybody heart diseases? BP? Can fold the index finger, touch the other 3 fingers, thumb, middle finger, ring finger. So this looks like a heart, Hridaya Mudra, heart gesture, Hridaya Mudra. So just change the mudra and practice the same. People with periods issues, interlock last 3 fingers. Your index finger and thumb touching towards each other, and it looks like an external guarantee. Yoni mudra. This can be practiced by both men and women. It's not just gender, but it is the essence of person. If somebody is very kind, it is a more feminine nature. The people who are more spiritual is more feminine nature. So femininity, masculinity exist in each individual. So you can practice. Okay, any other disease you'd like to say? I can share some one or two.
Arthritis.
Arthritis, I'll teach you Sandhi Mudra. Sandhi means joint. From right hand,
hypertension
middle 2 fingers and thumb. From left hand, first 2 fingers and thumb. This together constitutes Sandhi Mudra. So I have proposed a small research in Nimans stating what is the change in the mudra, gesture and fMRI, functional brain MRI studies. So this, if it is approved, we will be starting it soon. So this is according to yogic tradition, this is Sandhi Mudra. So they say that your shoulders, elbow, hip joint and knee joint, mainly these 4 joints, it will be helpful. Sandhi Mudra. Okay. Diabetes Apana Vayu Mudra. Apana Mudra. Apana Mudra can be practiced by diabetes. BP this one. Apana Vayu, same Apana Mudra, holding this. It will become Hridaya Mudra. So there is a secret in this. Thumb represents Agni. Index finger represents Vayu. Middle finger represents Akasha. Ring finger represents Prithvi. Little finger represents water, Jal, Varuna. So in essence, if I use this is the most commonly practiced mudra is the Jnana Mudra. Second one is this one, Namaskar Mudra. These 2 would be most commonly practiced. There are around 729 mudras discovered. Most of them were lost in Nalanda, Takshashila and all those destructions. So out of that, around 500 you can learn from us. See, are you convinced that there is something new in this class or not? Okay. Second, we will try Jacobson's progressive muscular relaxation technique. Acidity, you can practice Prana Mudra also. Simple. Prana Mudra can be practiced. Acidity, epilepsy, tiredness, migraine. Prana Mudra. Or Apana Mudra also can be practiced. Apana is the lower part of your body. All Apana energy you can practice. There is some religious people believe that anybody doing yoga are religious people. Not exactly. That's what we choose in yoga is as evidence based as possible. That's why we choose yoga and Ayurveda rather than any religious perspective. When Jesus picture you see, you'll be doing like this. If you have seen any picture.
Yes.
So this is nothing but Abhaya Mudra. Don't worry, I am here. Hindu people will see this, Abhaya Mudra. Don't worry, I am here. If somebody Lakshmi is doing like this means Varada. I give you boon. Abhaya, Varada. Jesus is doing this. Our Muslim brothers will be doing this when they are praying. It is nothing but Prana Avahana Mudra. If I do this in a bigger scale, it is a big Prana Avahana. I want to invite the cosmic energy within me. Then I do like this and then I imbibe it. So it is we are inviting the prana, cosmic energy and imbibing it within this. If you understand in this essence of understanding, there will be a beautiful harmony between us in this small world what we have within our DID world. So somebody says water. If I differentiate, it will become Ganga water or Zamzam water or holy water. If I differentiate, but we are only saying water. You can use it in any form. One of research conducted by Dr. Mosaro of Japan. I want you to note down this. Dr. Mosaro, Japan. They studied a water crystallography study. If some group of people keep a water glass in front of you and you scold the water crystallography study shows there will be disharmony or structure of the water molecule changes. If somebody is playing national anthem of any country, the symmetry of water structure will become absolutely symmetrical. So water can change its essence, means definitely the medicines also can change. Ayurveda believes that what Mahurtam you have to pluck and how to pluck, what should be the mind of a doctor, rather than a commercial purpose, just like I'll cut thousands of tulsi plants and make a tulsi decoction. It might not work. The potency of it might be reduced if you do it in a different way where you consider the time and energy. I know that you are getting a bit exhausted. Attention span is only 15 to 20 minutes. So let us practice deep relaxation technique where you will definitely sleep for a while. I usually use some mudra like this. It looks, I call it as, I don't remember a Sanskrit name, Astama mudra. This looks like lungs. Does it? Other one is bronchial mudra. Your water content need to be reduced. So I'll reduce the water content. This is earth. Earth is nothing but muscles, skeleton, all hard tissues of your body. This is middle. Sky is this. So I don't do anything with the air. Air entry should be good, water should be reduced. This is another one, bronchial mudra for asthma or bronchial issues or sinusitis. Running nose, your allergic animals, you can use it. So like this, some of the mudras. If you really do a study, 30 people, you can publish some of the research. Later you can speak regarding this to Srinivas sir. So second practice we are going to do is Jacobson's progressive muscular relaxation technique. Very, very simple. Jacobson was a Canadian physician who was very much interested in yoga, and he utilized this particular yoga nidra and made it his own technique. JPMR published some research papers mainly on anxiety, depression, psychosomatic issues, blood pressure, muscular pains and aches. So this is called as JPMR. There is some 15 minutes to 20 minutes audio we have made it on YouTube. Later I will give you the link. Every day night before you sleep, you may take up yoga further or not, I am not sure. How many of you would like to continue yoga in this campus? Okay. If you are convinced, you continue. If you are not convinced, please send us out. Let us practice JPMR. Very, very simple technique. 5 seconds of tightening the muscles, 5 seconds of relaxation of the muscles, and being aware of this difference. That's it. No religion in this. Absolutely. Do you find any religion anywhere?
No.
No. We will practice this. Come to the edge of the chair like this.
ಹೆಲ್ಪ್ ಮಾಡಲಾ ನೀವು ಮಾಡಿಬಿಡಿ ನಾನು ಮಾಡಲ ಇವಾಗ ಮಾಡಿ ಐ ಸೀನ್ ಅದು
Okay. So maybe some 12 to 13 areas simultaneously will make it construction followed by relaxation. संकुचन followed by विश्राम. संकुचन करना है और विश्राम करना है. Muscles, skeletal muscles. So this is one way of biorhythm change. You are sending your stress. It's exactly like a pressure cooker. Pressure is building up inside. The underneath of fire is nothing but your life events which are causing stress. Pressure is building up. Pressure cannot go out. Some people will cry and it will go out. Ventilation of emotions happening. Some people it will not happen. If the stress goes to your stomach, acidity. If stress is going to your back pain. So your stress is going to your blood streamline. Close your eyes, or you can open your eyes because it's first time you are practicing. First group of muscles you are focusing is forearm. So make a fist of your hand. Hold your muscles as tight as possible. Hold it tight, full tight. 1, 2, 3, 4, 5. Relax for 5 seconds. Okay. Next, bicep and tricep muscles. Hold like this. You're strong enough to take care of yourself and do yoga. Hold it tight. Full tight. 1, 2, 3, 4, 5. Relax. Let go. Feel the letting go effect. Third group of muscles, shoulders. Make your elbows straight. Bring your shoulders towards your ears and hold it tight. People who are sitting on computer will have this trapezius muscle spasm. 1, 2, 3, 4, 5. Release. Okay. Next, your forehead. You're raising your eyebrows up. 1, hold it. 2, 3, 4, 5. Relax. Let go. Next, your eyeballs, you are contracting your eyeballs or tightening your eyeballs as tight as possible, full tight. 1, 2, 3, 4, 5. Relax. Next, you're opening your jaw as wide as possible. Feel the temporomandibular joint tightness. 1, 2, 3, 4, 5. Relax and release. Be aware of the relaxation around the temporomandibular joint. Next, making your mouth in the form of O or give a wide smile. Even if it is fake, give it. Hold your muscles tight. 1, 2, 3, 4, 5. Relax. Next, tongue. You are taking the tongue up within the mouth. Hold it up. 1, 2, 3, 4, 5. Release. Next, the neck muscles. Pulling the neck muscles up like this. Hold it tight. If you are not able to, you can just stretch it like this. 1, 2, 3, 4, 5. Relax. Feel the relaxation around the neck muscles. Next is at your chest, you cannot do much muscular movement, so we will use the breathing technique. Holding the breath. Take a deep breath in. Hold your breath. 1, 2, 3, 4, 5. Release. Feel the letting go effect. Along with this letting go effect of your muscles, you also let go of your tensions and worries. And interpersonal conflicts, you also let it go. Let the institution thinks and does in one unification. Next is your tummy. Both hands on the tummy and hold this as tight as possible. Full tight. 1, 2, 3, 4, 5. Relax. Feel the letting go effect. Next, your buttocks and thigh muscles, you are going to hold it tight in this posture. Hold it tight. Squeeze your buttocks. Make your quadricep muscles tight. 1, 2, 3, 4, and 5. Relax. Last one. Below knee till the tip of your toes. Make your leg like this down and hold it tight as possible. Full tight. 1, 2, 3, 4, and 5. Release. Now you can close your eyes completely for about 3 to 5 minutes. Be aware of your toes, and you are sending subliminal message, sankalpa or auto suggestion to your muscles of your toe that let these muscles get relaxed. Just by these techniques, 20 to 30 millimeter of mercury blood pressure can be reduced. The sleep induction technique, I use this technique before sleep to induce sleep and to work on insomnia. So focus your attention onto your ankles. If you wish, gently move. Feel that your ankles are deeply relaxed. If somebody can put off the light, it would be great. Focus your attention onto your calf muscles. Your calf muscles are relaxed deeply. Now focus your attention around your knee, your thighs, buttocks. Feel at the back of your mind that your calf muscles, knee, thigh muscles, buttocks are deeply relaxed. Feel the letting go effect. Muscles of your lower back are also deeply relaxing, reducing your mind to guide the subconscious to work on your body. Very slowly and gently be aware of your abdomen. good amount of enzymes for digestion, and there is a good amount of blood circulation happening to rejuvenate or repair anything required anywhere, like gastritis, esophagitis, colitis, constipation, whatever is the issue. You just use your mind to divert your attention. Slowly shift your attention to your diaphragm area. There is a muscle which will divide your thorax, chest cavity from abdomen. You are so much relaxed that your diaphragmatic movement you can feel gentle breathing in, abdomen bulges out, gentle exhalation, abdomen sinks in. Breathe in, stomach bulges out, breathe out, stomach sinks in. Very slowly shift your awareness to your chest area. Your lungs are functioning optimally, sending good amount of oxygen to all the cells of your body, especially those cells which need more oxygen. The brain, kidney, liver, spleen, and other organs. And also send one message from the back of your mind that anywhere if there is a more requirement of oxygen, let this oxygen goes and repairs those delicate organs which are usually self-sufficient, but by chance if this is deranged metabolism, so let this be corrected. You're just sending a subliminal message. Your heart is pumping good amount of glucose-rich blood to all the parts of your body and making the skeletal muscles deeply relaxed. You can feel it at the back of your mind from your closed eyes. Your body is so relaxed that I am not able to feel that I am in this hall, and I feel as if I am into a dream state, psychic sleep. Very slowly shift your awareness to your entire arm, forearm, fingertips, wrist joint. You are working so hard from the morning till evening in front of your system, in front of writing, so many things you do with your wrist, forearm. Let good amount of oxygen and glucose fill these muscles and refresh, rejuvenate and relax. Slowly shift your awareness to your trapezius, shoulder, deltoid muscles, and slowly at the back of your mind let go all the burdens which you are carrying. The cough may be an output of subtle energy release through Vishuddhi or maybe some irritation. So this is other way of correlating with the chakras, subtle bioelectrical energies around your nerve plexus, where the endocrine system also exists. Shift your awareness to your neck area, head area. Let the head and neck muscles of your body, of your head, relax as deeply as it can. You can really feel it. If you connect body metabolic analyzer to your body right now, at least 24 to 36% of your body's basal metabolic rate would be reduced because you are into a different stream of psychic sleep where you are using it for healing your body, mind and spirit. Very slowly you visualize and imagine your entire body from the tip of your toes to the head, that all the skeletal muscles are deeply relaxed. 650 skeletal muscles, 230 joints, 206 bones. Beautiful. 84 lakhs of asanas. So nobody can do all the asanas and nobody is a yoga master. We are just a yoga students and we are studying, and while studying we are sharing this knowledge and content. With this, make one sankalpa, one positive affirmation that which is required for your body based on your complaints, whatever complaints you have. If you have back pain, say at the back of your mind that my muscles of the back am working by biogenic, autogenic training like this. Let my back muscles get relaxed and released and the pain be relieved. If you are diabetic, say that your stress trigger your response you are reducing and your stress response is less and you feel your blood sugar will be under more or less good control. Any one simple positive affirmation for the goodness of your health. Just think at the back of your mind and recall it or repeat it for about 3 to 5 times. And when you open your eyes later after this, you will see a magic. Use this silence to focus on that one positive affirmation at the back of your closed eyes on your mental screen with your eye of the mind. Focus and set the sankalpa. Very slowly and gently come back to body consciousness. Your body, breath and your inner spirit is in one alignment. Swastha, as Ayurveda says, the one who is established in the self. Swastha, swasthya. So right now you are established in your own inner self, where your spirit, body, mind and breath all are in synchrony, so that you can feel your muscles are relaxed, breathing is coordinated, comfortable, relaxed and regular, and your heartbeat is also very much relaxed. Very slowly and gently open your eyes to the new world of relaxed awareness. Slowly, bit by bit, piece by piece, open your eyes. Our beloved Dr.John Ebnezar is also here. As a surprise, slowly come back to your body consciousness. Don't doze off, please. Rub your hands towards each other. Massage onto your forehead, eyeballs, front of your ear, back of your ear, neck muscles. One more time. Rub your hands towards each other. Keep your both hands on top of your head. You bless yourself. You don't need any other God for you, because your spirit is a God right now. You bless yourself. And you slowly adopt Mudra. Those who can say one Om can say. Those who don't want will say one. Very unique. So, idea here is resonance bringing relaxation. We'll also try one. Take a deep breath in. One. This is what we experienced today. Thank you very much for you.
Just take a video of me.
Hello. Thank you, Dr. Drshashikant sir, and for this yoga practice and session. Thank you very much. Before now, there is a surprise that Dr. Ebnezar has joined us. So I request Mr. Raghunath to welcome him with a sampling. And I request all of you to please join on the stage. They are present. Please.
ನಿಮ್ಮನ್ನು ಕರೀತಿದ್ದಾರೆ.
We learned so much of yoga. We expressed ourselves in this environment of working from morning to evening. I request Dr. Shashikant to come forward for felicitation. I request Director Sir to felicitate our today's guest of honor, Dr. Shashikant. Lots of mudras. Thank you, sir. Thank you. Now I also, in continuation, Dr. Ebnezar had been a guiding factor all along, and he feels himself part of it here. So I am really thankful, and we have the occasion to felicitate you also. So I request you to please take the seat, and I request Director Sir to felicitate Dr. Srinivasmurthy, Sri Ganesh Sir, Jonathan, Drshashikant, all of you can join.
My dear Mr. Siddiqui, all the staff members, and dear you, people who are here, it is really a great pleasure for me to be back here again within a span of 2 months. So in that case, I feel that I am always a part of DRDO. And I received a letter yesterday from DRDO saying that they want to come to our hospital and they want a separate ward to be given and separate facilities to be given. I got a letter from them. I'll work on that and see how best I can help you and help ourselves in this process. Yoga, everyone knows the value of yoga. It's 5,000-year-old science. It doesn't need any big days like this. We celebrate and try to make a lot of noise. It doesn't need all that. It is a time-tested science which integrates the mind and the body both. And in our hospital, for the first time in the state, we have started an integrated health unit where we combine modern medicine along with yoga and Ayurveda and also other traditional medicines like acupuncture, acupressure, and cup therapies and all. And this concept was born because I and Shashikant, we did yoga courses together in Bangalore. He's an MBBS, my fraternity guy who took up yoga. He did MD, I did my PhD. So we went together and we shared the same ideologies. And when I took over as a superintendent, then we decided that I collaborate with Shashikant and start a unit which will cater to both modern medicine as well as traditional medicine, and start a unique center wherein the patients will be benefited. So for the first time in the state, in a state-run hospital, we have got an integrated health unit where you will find modern medicine along with Dr.Shashikant giving you the services of traditional medicine. He himself is an excellent amalgamation of both. He is an MBBS guy with yoga. So it is all scientific. It is not any just like quackery or some hypothesis. It is a proven technique, the proven fact that combining traditional medicine with modern medicine works wonder. That's what was the message of Swami Vivekananda too. He said the East should learn from the West and the West should learn from the East. That's what he told some centuries back. How relevant it is today. It is very relevant. We can't treat chronic disorders only with allopathy. It is impossible. Say diabetes, hypertension, asthma, obesity, and arthritis, all these kind of things we just can't treat only with drugs because drugs are poisonous. You can't give the drugs for a long time and the patients will develop side effects. So we require something, and these allopathic medicines, though I'm an allopathic surgeon, has got its limitations. It can't cure the disease. It can only subside. It can only suppress the symptoms and not cure the disease. So, but a patient with arthritis or with diabetes is going to be a lifelong patient. So we need to address the issue completely in a different manner. And allopathic science will not take care of the mind. And the mind is the main upper chamber which controls the entire human body. And the healing process, the healing should happen in the entire body through the active participation from the brain. It is the brain which perceives stress, it is the brain which perceives relaxation both. And it is very vital that we signal or we trigger the healing features what we have got inside our body, and that allopathic science doesn't do.